Okay, this video is called Are Medical Textbooks a Joke? And yes, they are. It's kind of sad. I mean, it's kind of funny, but it's kind of sad. I'll just tell you the truth here. This could be an open letter to doctors so they can know what they need to learn. They don't go through life just being pathetic ignoramuses. It's also a note to patients to realize there's a very good chance your doctor is completely incompetent and ignorant and doesn't know what they're doing. So medical school is basically a guild barrier for being able to become a drug dealer to sell prescription drugs. Now, don't get me wrong, residency training goes on and there's a lot of subspecialties, and medicine does do a lot of good things. It's very good at acute care. It's pretty good at a lot of end-of-life issues, putting a patient on dialysis, doing a kidney transplant, putting in kidney drainage tubes, percutaneous nephrostomies for obstructed ureters, things like that, okay? But let's talk about what the problems are with medical textbooks in medical school. First of all, the books are designed, and the school is designed to hide the truth about what causes disease and how to treat disease. It tricks young people into think they're actually learning the real stuff. Instead, they learn all this irrelevant stuff about rare diseases. They can tell you the 10th manifestation of lupus, but they can't tell you what atherosclerosis is. These books, they get doctors to sell drugs. Okay, the system wants drugs to be sold. That's the main way the medical system makes money. It also sells lab tests. It sells imaging tests, like CAT scans, and it sells surgical procedures and implanted surgical devices, for example. The basic motto theme of medical school is match the ill to the pill and send a bill. The students are trained to think that treatment revolves around prescribing drugs. And I was even taught, that surgery is when there's a failure of drug medication. But the joke of it is medication is really a failure of nutritional therapy if you actually know what matters. And the medical system's sort of like hanging on to its drug dealer method, sort of like Ptolemy system of astrology, okay? Every day I see patients with obesity, hypertension, diabetes, atherosclerosis, abdominal pressure syndrome, going to doctors who have the same diseases and nurses with obesity, hypertension, diabetes, atherosclerosis, and abdominal pressure syndrome. It's a big joke, and almost no one is aware of it. I would say in a given hospital, maybe about 1 out of 1,000 person actually has a decent understanding of disease. And that's a true statement. Not to be mean, don't get me wrong, there's some very good surgery doctors, for example, that really know their surgery. There's very good pathology doctors that really know their pathology. But in terms of a basic understanding of what causes the common diseases, it's literally about 1 in 1,000. I mean, it's difficult for me to find anybody capable of an intelligent conversation, and I'm not joking, about medical topics. Okay, so why is it that it's so bad? Because internal medicine, medical school, which is primarily training in internal medicine, it doesn't teach NETs, NETS. NETS are the most important things. You can just remember that mnemonic, the acronym NETS, NETs. The most important stuff to know about health and disease causation is nutrition, epidemiology, estrogenics, so 2-letter E's. I could have made it NEATS, but NET sounds better. Toxicology, and then things that start with the letter S, spirituality, religion. Religious people are much healthier. Sedentary versus exercise. They learn a little bit about exercise, not much. They learn a little bit about sleep, but not much. Good luck. Go ask them if they know the lymphatic system. The most important issue is sleep. They won't know it. What's involved with sunshine? They'll know sunshine makes vitamin D, but they won't know about its effect on blood flow, for example. Stress. There's a lot of good stuff to know about stress, and most of that's not known by doctors. Okay. Like the fact that it's an excitotoxin. Okay, if there's excessive amounts. All right, now the biochemistry books, for example, they routinely either don't mention a specific diet or they recommend a high-fat diet. Completely stupid. They don't talk at all about blood flow, which is like the most important thing. If you want to heal anything, you need to have good blood flow. They don't provide information about common important inhibitors of metabolism, like F- fluorinoiodide, arsenic. They provide nothing on mitochondria inhibitors. I figured that all out by going through the journals. I pretty quickly found about 60 of them. They don't cover iron overload, oxidative stress. So these are basic biochemistry topics. They are not in the biochemistry books. I was very, very familiar with what's in those books. I own about 7 of them. They do not cover lipid peroxidation of omega fats, toxic aldehydes, hydroxynonenal, Yamashita theory, etc. Okay? You go to the gastroenterology books. They don't talk about dietary fiber, okay, and Burkitt's abdominal pressure syndrome, the foundation of abdominal disease, okay, and it's not even in the books. Leaky gut. Gastroenterologists don't know this, okay? Metabolic theory. There might be a few really, really smart ones that read a lot on their own, but the average gastroenterologist will not know it. As a matter of fact, I know a gastroenterologist, and he's actually the best one at doing procedures. But he thought Mediterranean diet was the best diet. He doesn't know anything about nutrition, okay? Metabolic theory, he's fantastic at procedures, but he doesn't know nutrition. Okay, metabolic theory of cancer. It's a pretty important thing to know, okay? So what I'm trying to say is they don't know gut physiology. These are the doctors that do all the scopes. They know pathology. They know how to look at a polyp. They know what cancer is. They know how to remove it with their endoscope. But they don't know the basic pathophysiology of cancer, leaky gut, abdominal pressure syndrome. These are the most common abdominal diseases, okay? They don't know nutrition. They know almost nothing about fatty liver's relationship to diet and fructose and all that. Okay, let's talk about kidney doctors. Good luck finding a kidney doctor who's read Kempner. I haven't found one yet. Kempner was like the most important thing to know if you want to protect the kidneys with low-protein diets. He's the one who kept all those people off dialysis for so long, kept them alive before dialysis existed. Almost nothing about how kidney stones are formed. Okay, let's talk about atherosclerosis and coronary artery disease. All they do is emphasize cholesterol because you can sell a statin drug for it. You will, and then they talk about stents and surgery, You will not be able to find a doctor who knows that atherosclerosis is a blood clot. That's the fundamental thing to know, okay? They won't realize that, stents and surgery don't increase longevity in your typical coronary artery disease, chronic angina patient, okay? They just don't know atheromyces. They won't know any of the pioneers of atherosclerosis like Gregory Sloop, William Roberts, Walter Kempner, Dean Ornish, Caldwell Esselstyn. They won't know. This is more recent stuff about the successful treatment of congestive heart failure with a vegan diet by Baxter Montgomery as well as by Robert Ostfeld, okay? That's an incredible thing, congestive heart failure reversed with vegan diet. That's an important, incredibly important thing. Okay, hypertension. They won't know the Richard Moore book. That's a magnificent book. It's the best thing ever written on hypertension. So Richard Moore's book is called High Blood Pressure Solution. The guy devoted his whole life to doing research on plasma membrane ion pumps, and he talks about the importance of having higher potassium by at least 5-fold compared to your sodium intake. And how do you get that? From eating plant foods, okay? That's how it always is. The good stuff's in plants, the bad stuff's in processed food, and to a lesser extent, the bad stuff's in meat as well, okay? Other pioneers of work on hypertension, Roy Swank did great work on showing blood sludge, making videos of it. That's available at the McDougall YouTube channel. Walter Kempner, reversal of patients with severe hypertension, systolics in the 200s. Nathan Pritikin with similar work. Jack Delatorre's theories about the relationship between hypertension and dementia. Okay, diabetes. They won't know any of the papers. I went and asked the best internal medicine doctors, who are the best endocrinology doctors, diabetes experts. I wanted to talk with them because I was interested in diabetes, how it causes dementia. And I went and spoke with these endocrinologists. These are the best university-trained endocrinologists that train the fellows in endocrinology, okay? They're the epitome, the zenith of expertise in endocrinology. And not a single one had read any of the basic papers: Sweeney, Hemsworth, Rabinowitz, Kempner, Brownlee, Shulman, Roy Taylor. I was like, excuse me? They know all the drugs backwards and forwards, but they had not read these papers. Now, don't get me wrong. Gerald Shulman himself is a Harvard-trained MD, PhD endocrinologist, and he's the guy who did the work that showed with magnetic resonance spectroscopy that accumulation of fat within the skeletal muscle is the earliest detectable finding of insulin resistance. Okay, so that's a great paper. It's genius work. He won the Banting Award as the best diabetes researcher in the world in 2018. Okay, Michael Brownlee's paper, 2004 Banting Award, that paper is like a miracle, okay? It's like, an angel of God is speaking through Michael Brownlee. That paper's so brilliant. I told you about that one before. I cried when I read it. It was so magnificent and brilliant. Okay, let's talk about autoimmune disease. There'll be nothing on leaky gut. That's the most important mechanism of autoimmune disease. It's not even in the chapter, okay? The chapter's a joke. And I'm talking about the big, 1,500, 2,000 page books of pathology. They will not have this in there, okay? When you go through rheumatology, you won't hear a word about leaky gut. There'll be nothing on postprandial endotoxemia, amyloid clotting, molecular mimicry, and autoantibody cross-reactivity. It's freaking ridiculous. The books are basically removed of all useful content, okay? Nothing about dairy causing multiple sclerosis or type 1 diabetes. That's pretty important to know. A lot of parents wouldn't have their kids drinking milk if they knew it caused type 1 diabetes. There's nothing about Roy Swank on multiple sclerosis. I can tell you this to this day. I have friends that are fellowship-trained neurologists and pretty smart people. They've never heard of Roy Swank. Okay, he's the most important person to know about in terms of multiple sclerosis, the most important neurologic autoimmune disease that I see every week, multiple cases of it. Okay, no toxicology-related information on PAMPs and DAMPs, effects of F-GP, none of this stuff. Oxidative stress. You won't find anything significant in the books. You'll hear a brief mention of it, like in an ignorant, superficial way, but you won't have any good understanding of it. There'll be nothing about Douglas Kell and Etheresia praetorius, their papers on ferrous redox cycling and amyloid clotting, okay? So anyways, people might ask me, how am I so confident? Well, I'll tell you why I'm so confident. I know these books pretty well. I got 99% on my boards in med school and residency, and I've been searching for trying to understand these diseases for many years. And I couldn't understand these things until I started reading the nutritional literature. And then I went from the nutritional literature to the pathophysiology literature, and I'm like, holy crap, tons of these things. The causes are known, the diseases are known. It's just sitting in the medical literature, and there's nobody to sort of like bring it to life, if you will. And there are some people who do read these papers a little bit, and they sometimes do some good teaching. But on the internet, most of the internet's pretty corrupt, and everybody's trying to sell supplements and their favorite foods and get sponsors. So anyways, it gives my channel a purpose, so I will continue to try to serve this purpose, be a lighthouse for people to help them find a safe path to health within all the chaos. Okay, continuing on, infectious disease. There'll be nothing about iron-related reactivation of dormant bacteria, postprandial endotoxemia, and the way high-fat diets suppress the immune system, which is pretty important to know if you're trying to heal an infection. Cancer. There'll be nothing on the metabolic theory of cancer. The most important concept to know in cancer, the Otto Warburg theory, Otto Warburg effect, okay? Super freaking important. It's not even in the books. There'll be nothing significant on the dietary therapy of cancer. Something like Gerson won't even be in the book, okay? Gerson, you put a video up about that, it'll get taken down. On the other hand, a Seafried video gets promoted. I wonder why. Maybe because the other one's more effective. It's the truth that gets, clamped. It's not lies and BS. Travel freely. And get promoted. Vegan survivors of metastatic cancer. You won't find, Ruth Heidrich and all the other ones in these books. Okay, dementia. There's nothing about Jack Delatore's chronic hypoperfusion mouse equivalent theory. That's the fundamental, most important theory to read about to begin to understand dementia. Okay. All you'll hear about is all this Alzheimer's nonsense, which is a whole bunch of, manipulation to get more funding, okay, for BS, okay? You won't hear about my theory, the supply and demand theory, which is really the best theory of neurodegeneration. My theory and Delatore's, I think, are the two most important ones. Mine goes into more detail. Don't get me wrong, Delatore's is great, but I explain, over 60 different things you can avoid to minimize your risk of dementia. That's pretty useful to know what to do. Nothing about Tetsumori Yamashima. He's like the MD, PhD Japanese guy. He figured out the omega-6 cooking oil theory, how that leads to toxic aldehydes, and then calpain, cathepsin, proteases, auto-digesting the cell. It's useful to know. Bottom line, don't eat omega-6 cooking oils. Nothing about the Kell-Pretorius-Blaylock theory of neuroinflammation, which overlaps with the microglial activation theory of Jared Younger. Nothing about that. Okay, that's important to know. Okay, and it's going to tell you the same thing. That's going to tell you why you want to be a low-fat vegan with no oils and avoid those other toxins like MSG, MFG, and all that stuff. There'll be nothing on the no theory of Martin Pall, which means nitric oxide and peroxynitrite. I've given lectures, by the way, on every single subject here in this thing today, because I know the book stinks, so I'm substituting for the books. I've basically rewritten the internal medicine textbooks and much of psychology, psychiatry, and neurology. And spine surgery, because not the surgeries, but I've explained what causes spinal degeneration, the most common causes of it. I wrote an entire book on that called Ischemic Spine is the most common cause of back pain. This stuff's important to know if you want to have a chance at healing your back pain and preventing your spine from going down the tubes. It's good to know this stuff. Okay, neurology, like I said, I like neurologists. A lot of them are smart and they're nice and they mean well, but they really have not been educated that well. If they want to learn, I got all the videos. I got a playlist of all these videos about the brain. Okay, I can tell you the neurology textbooks are an absolute joke. I own them. I own the 1,500, 2,000 page neurology textbooks, and they're a joke. Okay, for example, on excitotoxicity, there'll be like 1 or 2 paragraphs in the entire book. That should be like a 100-page chapter. It's like super important. That's why I have all the videos about it. Even their understanding of seizures. They don't know nutrition, and you need to know nutrition to know all the excitotoxins, okay? I mean, it's pretty important. They don't know stress that well. They don't know leaky gut, leaky blood-brain barrier. Please. That's an important part of treatment in stroke and traumatic brain injury. You have to learn nutrition if you want to be top-notch. I'm sorry, but that's reality. Spinal degeneration. In your field, you can make a lot of money and be prestigious for throwing drugs around, but if you really want to get good results with patients, you have to know nutrition. Spinal degeneration, my theory of ischemic spine degeneration and how it relates to everything, DISH, OPLL, OLF, and F- and GPR related, lack of vitamin C. That's the foundation of the spine. All the doctors I know with spine who I work with, they all tell me I'm absolutely right, but the journal won't publish my article. That's what pissed me off. That's why I wrote a book about it, because there's no money in it. You don't make money if you teach the patient how to help themselves. You make money by injecting them with steroids and doing surgery on them, okay, and selling them drugs. In psychology, we've talked about what a joke psychology is. I wrote about that at length in my recent book, Food, Mood, and IQ, where basically I say they're the priests of modernism. They are the enforcers of modernism BS, okay? They have no moral foundation. They don't know the difference between a man and a woman. How can somebody who doesn't know the difference between a man and a woman give advice about relationships? It's a joke. They don't have any, morals. They don't have any sense of right or wrong. If you ask a psychologist, what is good art? As far as they're concerned, modern art is the same as Renaissance art, which is completely stupid. Renaissance art is great. Modern art is a joke. It's a fake. It stinks. They can't tell you what is good behavior. A Christian can tell you. The psychology of Christianity is much better than the psychology of psychology. A Christian can tell you what good behavior is. Try to be like, Jesus, Mary, and the saints, okay? They can tell you what a good life is, same answer right there. They can tell you what good art is, good literature, good architecture, the cathedrals, okay? Whereas psychologists can't make a judgment. Well, somebody who can't make a judgment in life, you have to make judgments about what is good and bad, what should I do, what should I not do, how will I spend my time, how will I live, what kind of people do I want to associate with. You have to make those decisions. You can't escape from that. Psychology breaks up families. It promotes divorce in a big way. Every guy I know says the psychologist tried to get them to become divorced and went against the husband. Okay, I'd recommend any guy to avoid psychology counseling in their divorce discussions. And the psychologists pretty routinely send the patients on up to psychiatrists for drug dealing. Okay, psychiatry is one of the biggest jokes in all of medicine. The great psychiatrists, like the best one who ever lived is Bregan, Grace Jackson, and the other ones, they'll tell you that virtually all the psychiatric drugs cause a lobotomy. Some more rapidly, like the antipsychotics, other ones more gradually, like the antidepressant treatment drugs like selective serotonin reuptake inhibitors, but they're all brain poisons, okay? You're not going to poison your way to health. Anyways, I hope this cautionary tale of what a joke to medical textbooks is something for doctors to realize. This is what you need to learn, okay? Know the gaps in your education so you can make yourself a better doctor. Don't go through life being a pathetic ignoramus. And this is good for patients. Once you realize that, how is a fat, hypertense, diabetic, atherosclerotic doctor going to help you with those problems for yourself? Anyways, I hope this was helpful.